Well, good afternoon, and thanks for joining. We're just going to let folks settle in here, and we'll get started shortly. And thanks for joining. We're just letting folks settle in, and then we'll get started a little bit after uh, about 1:15, 1:16. Mhm. Well, good afternoon. We'll get started. Welcome to the session titled "A Collaborative Approach to Reducing Falls in Wisconsin," the Falls Free Wisconsin Initiative. I am your moderator for the session. My name is Alfred Johnson. I'm on the MIPA board as the secretary. I will be here to support our session speaker and monitor the chat for questions and also just monitoring overall. If you do have questions, we ask that you put those into the chat. The speaker will take questions at the end of the session. So I'm excited to introduce our speaker for today. Suzanne Morley currently serves as the Falls Prevention Program Coordinator at the Wisconsin Institute for Healthy Aging. She graduated from the University of Wisconsin-Stevens Point with a degree in health promotion, wellness, and a desire to work in community health and prevention. Before joining the Wisconsin Institute for Healthy Aging team, she worked for a suicide prevention nonprofit and as a community health specialist in a rural health and within a rural health department. In her free time, she stays active. She loves to be outside and spend time with her son and her husband. So, welcome. The floor is yours.
Awesome. Thanks, Al. Go ahead and share my screen. Okay. Like Al said, I'm here to talk a little bit about what we have going on in Wisconsin with our Falls Prevention Initiative. So like Al said, I'm the Falls Prevention Program Coordinator with the Wisconsin Institute for Healthy Aging, or as we like to call it, WIHA. If you're not familiar with WIHA, we're a nonprofit administrator of evidence-based healthy aging programs in Wisconsin. And our goal is really to bring evidence-based programs to communities throughout Wisconsin to encourage healthy living and healthy aging. We work with researchers to identify needs in local communities and then bring programs from the research phase to the implementation phase into local communities. So we train facilitators of programs to be able to bring those to the local communities. We also partner with a number of organizations throughout the state that are the facilitators of our programs or are engaged in advocacy or our coalitions or initiatives alongside us. I'm just going to start by just sharing a little bit about what the evidence-based health promotion programs that we has are. So we have Healthy Living with Diabetes, available in both English and Spanish. Living Well with Chronic Conditions, again, available in both languages. Healthy Living with Chronic Pain, Walk with Ease, Physical Activity for Lifelong Success, Stand Up for Your Health, Mind Over Matter, Healthy Bowels, Healthy Bladder, and then Stepping On, which is our falls prevention program, and that is also available in both English and Spanish. Our Stepping On program is a 7-week program. It's multifactorial, so it addresses things such as footwear, medications, vision, a number of different things. And then we also provide coordination for the Wisconsin Coalition to End Social Isolation and Loneliness, and the Falls Free Wisconsin Coalition, which I'll talk a little bit about in this presentation. So just to paint the picture a little bit about falls in Wisconsin, if you're not familiar, or this might just be a brief overview for you. So nationally, more than 1 in 4 older adults falls each year. Wisconsin, unfortunately, holds the title for the highest rate of injury-related deaths due to falls among older adults in the country. And in 2021, so just a couple of years ago, over 43,000 older adults in Wisconsin went to the emergency department for fall. And as we know, medical costs for falls are very expensive. So in 2020 to 2021, that cost was $427 million and increasing over the years. Just this past fall, the Wisconsin Department of Health Services released a report that indicated that EMS in Wisconsin responded to over 133,000 falls. And the number of falls that EMS responds to are increasing by nearly 10,000 a year statewide. So again, that taxes resources and capacity, and there are a lot of costs associated with those falls. In addition, we also know that older adults are concerned about falls. So we had the Wisconsin Institute for Healthy Aging did a survey last year, and over 700 older adults were asked which of the following is a concern from them as they age. So you can see a number of different things people are concerned about, but that one on the bottom, preventing falls, over 534 of the 700 were concerned about preventing falls as they age. So not only do we see it in the data, but people are also worried about it. Falls are the leading injury category in Wisconsin. So if you're not familiar, ICD-10 is a system used by physicians to classify and code diagnoses, symptoms, and procedures for claims processing. So the section on there that is highlighted is the slipping, tripping, stumbling, and falls section, which, as you can see, is 62% of all injuries. And for those 65 plus, that accounts for 75% of those injuries. We also know that most older adults' falls happen in the home. You can see by a long shot, private residence is where falls are occurring. And a lot of the work that we do talks about how to prevent falls at home. So our falls takes a public health approach to falls prevention in Wisconsin. So we know that falls are a leading cause of injury, hospitalization, and institutionalization for older adults, but they don't have to be a normal part of aging. So we want to look at addressing the root causes of falls, promote programs like Stepping On, but then also practices that reduce falls risk, and then instill a belief that falls are preventable. So in some of the work that we've done in the past year or so, we've done some focus groups, and some of the older adults that we've talked to have indicated that they believe that falls are just a normal part of aging. It's just something that's going to happen to them as they get older. There's nothing they can do to prevent those falls. So one of our first steps and something that we're working on is to kind of dispel that myth and then educating people on the things that they can do to reduce the risk of falling. So I coordinate our Falls Free Wisconsin Coalition. The coalition was reinvigorated in 2021 and provides backbone support for our statewide falls prevention initiative. This is our organizational structure for the coalition you can see on the screen. So we have the organization I work for as the convener and the coordinator for the coalition. We have our steering committee. We have 3 work groups, so best practices in local communities, data collection and analyzation, and public awareness. And then this year we also developed an advisory committee. So that's made up of individuals from different sectors. There's older adults on that one. There's people from different racial and ethnic backgrounds, different organizations, rural and urban centers on the advisory committee to help support the work of the coalition and make sure that it's equitable throughout the state. And then we also have almost 70 organizations that are signed on as coalition members. And those are individuals from healthcare organizations, aging and disability resource centers, public safety organizations like fire departments and EMS, public health, managed care organizations, and more. So I'm just going to talk a little bit about what the coalition has done in the past couple of years. So our best practices work group has really worked on local coalition support. So they put together a Falls Free Wisconsin Coalition Quick Guide, which basically kind of goes into how to develop a Falls Free Wisconsin or a state or a local falls prevention coalition, how to form that, who could be involved, how to maintain it, and things like that. And then we also work on collecting and sharing best practices to share throughout the state. Our data collection work group is new this year, but we started working on collecting and analyzing falls data. Something that we hear a lot is, do our Wisconsin winters attribute to why we have such a high rate of falls in Wisconsin? Is the alcohol use in Wisconsin? So we're kind of looking at digging into that a little bit to understand more about why we do have such a high rate of falls. And then we're hoping to be able to provide data customization for local communities. So you can see we developed a map where people can see locally by county what the falls rate are in their communities. We have developed information on where people can find information on falls that they can use in their communities. And then we have a data report that we've used, and you can see just a screenshot of that data report on the screen, which covers the average cost of falls per person by county for emergency department visits and hospitalizations. Our public awareness work group is really focused on not only consumer education, but also professional education. So we, for the work group for public awareness, take care of the Falls Prevention Awareness Month resources. Here in Wisconsin, we have a whole month dedicated to falls prevention awareness, and we have a governor's proclamation that we've gotten the last few months for that. We also develop social media posts that can be put out and used locally for falls prevention information. And then we host a number of webinars as well for professionals in the state. So just a couple that we did this year, our public safety approaches to falls prevention, and then bringing Falls Free Wisconsin to your community. We have also been engaged in a little bit of public policy work. So Wisconsin currently has a budget surplus. So we've been working with legislators on a bill to provide state support for falls prevention. This is still currently making its way through the legislative process, but it would provide, if it goes through, $756,000 for 2 years to support falls prevention work in Wisconsin. Just this past year, in 2022, we were the recipient of a federal earmark. So due to that federal earmark, we were able to award $70,000 to 10 organizations in Wisconsin for local efforts. So the goal of the grants, which we are calling LEAF grants, or localizing efforts to address falls, was to fund local organizations to support sustainable falls and injury prevention efforts in local communities with a focus on underserved populations. So the LEAF grants ran from the 1st of this year until August 31st of this year. And the grantees worked on a number of different things. You can see on the screen, there's just a screenshot of one example of what one grantee did. So they were doing a Latin dance program called Activate by Londo, and looking at the impacts of balance and social isolation from that program. Other grantees worked on collecting falls data, implementing programs like bingo size, strong bodies, and stepping on, working with fire departments for referral systems, for lift assists, distributing falls prevention resources, building populations, or building relationships with underserved communities to be able to develop programming for the communities, and even more. So right now we're kind of still getting the final reports of the LEAF project, but we're hoping by the end of the year that we'll have a final report that summarizes all of the things like that are shown on the screen, the activities, the partners, the outcomes and lessons learned, and sustainability and next steps, so that individuals throughout the state can look at those and see, hey, maybe I could do this in my community, or what might I be able to implement in my local community. So if we receive the state budget appropriation that I just mentioned, that's still going through the legislative process, our plan is to do this again and be able to support local communities for falls prevention efforts. Well, that brings me to kind of the main purpose of my talk today. I wanted to really focus on our fallsfreewisconsin.org website. So this is another part of the federal earmark that we received last year, was to launch this new website. So it did launch this September, so just a couple of months ago, and it was really guided by WEHA and then the statewide falls prevention coalition. So the goal of the website was to be able to develop resources for consumers, for families, and for caregivers, so that they could find falls prevention information and motivation. I apologize, getting over a little bit of a cold, so losing my voice a little bit. But we have printable content for preventing a fall on our website. We use simple language, not a whole lot of technical jargon on there, and allow for planning tools for safety. So we did promote this pretty heavily in September. And I'll talk about that a little bit later on in the presentation. But we're using our partnerships to reach out to the older adults in Wisconsin so that they're aware of the website so they can use the resources on it. We have a virtual home safety challenge, which I'll show in a little bit as well. We use interactive quizzes and tools. And we have been collecting stories from older adults in Wisconsin that have fallen. So those are highlighted on their website as well. So people know, hey, I'm not alone. This isn't just happening to me. This is something that other older adults are struggling with. And then we also provide access to evidence-based falls programs. We know that until individuals and families and caregivers believe that there's a role to play in reducing their falls risk, that there's things that they can do, we're going to have a little bit of a harder time getting them to act for falls prevention. So that's why we want to be able to provide all of this information that we have on the website. In addition to the website for consumers, we also have a lot of information for our partners on the website. So the number of partners that I have mentioned previously, we also wanted to be able to support them in their falls prevention efforts. So be able to provide easy to access resources and interventions, be a source of best practices or systems development, provide data, like I mentioned, to be able to make the case for falls prevention in local communities, provide technical assistance for local groups to implement or launch falls prevention efforts or coalitions, and then support the dissemination of falls prevention evidence-based programs and practices. So I'm going to take a pause on the presentation and go to the website actually so you can kind of see what it looks like if you haven't seen it already. So this is the landing page for the website. It's just fallsfreewi.org. We have a number of different things that I'll highlight. If you go to our Prevent Falls section, this is the section that's for older adults and their family members and caregivers. So this is kind of the bulk of the education on the website. We have a number of different tools throughout that you'll kind of see. So we have these buttons where you can click on and get more information. And then also these kind of smaller landing pages. So I'll just click on a couple of these so you can kind of see what sorts of information that you'll find. If you go to Learn Your Falls Risk, we have some interactive tools and quizzes so you can test your knowledge of falls. You can go through this quiz, or you can also take the National Council on Aging's Falls Free Checkup to learn more about your risk. This is where I mentioned we have information from other older adults that have fallen in Wisconsin. So a number of stories, both video and text that you can read through from people that have fallen. Information on, hey, maybe I have fallen. What do I do if I do fall? So information on what you can do for that, or what to do if you're with someone who falls. And again, we have a lot of different videos and different interactive. We have a video from a physical therapist that explains how to get up after a fall. We link out to different things on the website as well. So if we're talking about something that is another resource on the website, that would be linked. You can see a number of links there and some to external websites as well. And then I'll click on some of these other pages here. So on some of these more minor landing pages, we have drop downs. So if you want to learn more about grab bars, you can click down and there's pictures and videos embedded throughout those as well. And I'll just kind of show a couple more of these that you can kind of get the feel for what's on here. So canes and walkers, how to use a walker correctly, how to use a cane correctly. We spent the past year kind of really developing this content, talking to experts about the content and what should all be on the website for falls prevention. Let's click on one or two more of these so you can see. Again, we have information on balance and strength, And then we also have a number of handouts on the website too. So if someone wants to start exercising and use an exercise log, they can click on this and print it out or download it on their computer. And we have some balance and strength exercise videos here as well. If, hey, maybe that's not your thing, you prefer something written out, we have those written out as well with a handout that you can print off. And then links to find a falls prevention workshop near you. We also have, as you can see, some different quotes throughout the website. So sharing more of those personal stories, real people in Wisconsin that have fallen or have been willing to share their story of going through an evidence-based program with us or what they've done for falls prevention. So that's kind of the bulk of the consumer content and education that we have. And then we also have this home safety challenge. So we're really excited about developing this home safety challenge. It's an interactive tool that you can use as, like I said, we know most falls happen in the home. So we really wanted to be able to provide a lot of education about that. So there's this landing page and you can see instructions and different information on how you use it. But I'm going to go right into it and kind of show you how it works. This is something that older adults can use. This is something that individuals at aging and disability resource centers or healthcare organizations can use with their clients or with their consumers. This is something for family members to be able to use too, that they can walk through this either by themselves or with their family members or people that they take care of. Just be able to show what are the hazards in people's homes and what you can do to prevent falls in people's homes. So this doesn't show just the hazard, this also shows tips and tricks. So things that you can put in your home that may help reduce falls risk. So I'm just gonna click some of these so you can kind of see how it works. So if you kind of just move your mouse around, you'll notice that some things are lighting up. Hopefully my internet isn't too slow where you can see that. But once you see something, you would click on it. And then there's a pop-up that comes up and it tells you, hey, this is missing. You should have railings on both sides of the step, and then what you can do about that. This is a fall hazard. It's an unmarked erase threshold, what you should do about that. This is a tip, so lack of lighting at night, make sure that you have bright outdoor lighting, and then so on and so forth. So you just kind of click through this, figure out some tips and some hazards, what you should be looking for in your own home. There's a couple of different features here. So for visitors, this will just kind of give you a little bit more instructions if you need it. This is 360. So we kind of modeled this after, if you're looking for a home on Zillow, it's a 360 tour of a house. And then there's also in here so you can kind of see where you're at and where you want to go. So we have living room, dining room, kitchen and garage also. And then up here is kind of where you can see how many things that you found and how many you have left to find. So there's hazards and tip present, there's 9, and then I found 6 so far. And then you can show hints if you're kind of struggling to find the rest of them. So I didn't see this one. There's one here, should have an outdoor grab bar. Make sure to look out for wet and icy pavement. And now I found all 9 out here. So then the check mark shows up and then you'll go to the rest of the house. And that's kind of how you would navigate the entire thing. So you'll see these arrows. You can go this way. And again, 360 view, go through the home and identify different things that are hazards or maybe you should implement in your home. So this is something we're pretty excited about being able to offer because again, like I said, most falls do happen in the home. So providing that education is super important. Then going back to the website, just want to highlight a couple of the things that we have for professionals. We have a number of different resources for professionals. You've seen screenshots so far of what we have for data on the website. I'll just share a couple more things. We have this resource for best practice programs that people can look through and implement in their local communities. So hopefully this will load here. So there's a number of different falls prevention and physical activity programs that might help to reduce falls that you can click through and see what might be a good fit for your community. So you click on this, it gives you the description of it, the evidence level, it's high level or no evidence. Is it a falls prevention program? Is it a program? Is it an initiative? Or is it an event? It gives you the target market, program design, leader qualifications if there are any, and then links for more information. So you can click through, so you can kind of see the differences. First, we have physical activity programs, like I said. We have some that are preliminary evidence, so just have some evidence behind them. We have some that are initiatives and some that are just events and different things. So people can look through this and see what they might be able to implement regulations. We also have the section here for how to help, and this is for different organizations. So if you're a health system, you can click on here and we have just a number of different things that we recommend people do in that organization. And then again, links to different resources and different handouts. So the CDC study algorithm, stepping on brochures, falls risk assessments. We have a number of referral examples on here and leave behinds for public safety, for community organizations, how to plan a falls prevention event, leveraging data, implementation guides, sample presentations, just a number of different things that different organizations can use for their organizations and their populations. We share news and updates as they come in. We have information about the Falls for Wisconsin Coalition. We already went through information on how to start a coalition, which goes through that toolkit that I mentioned in an interactive platform. Requests for technical assistance, and then we have a number of promotional resources as well. So we want people to share out the Falls for Wisconsin website widely and let their consumers know that this resource is available for them, and then also share it for to their peers and different professional organizations. So we have newsletter articles, social media posts, letters to the editor, consumer handouts, and a number of different social media posts and other toolkits. So super exciting resources on here, at least I feel like they are. We spent a lot of time last year developing all the resources for the website, and we're pretty excited to launch that this fall. I'm gonna go back to my presentation and kind of share the lessons learned since we did launch the website in September of this year. We did kind of a soft launch starting mid-August. And this shows just the website traffic just in the first month and a half or so. And I'm just going to highlight a couple of things that you can see have some peaks. So on the 16th of August, I held a webinar for our partners on promotional resources. So spike to the website traffic then. On the 21st, so that webinar was sent out to our partners. On the 30th of August, we sent out a email to our partners saying that, hey, this website, you should start sending people to it. It's good to go. We want to drive people to the website now. And then we started doing a media tour in early September as well. So in Rhinelander, or on September 8th, we were up in Rhinelander at a press event and interviewed by a news station there. On the 12th of September, the Department of Health Services launched or released a press release on the EMS report that I mentioned briefly, and Falls for Wisconsin and WEHA was mentioned in that report. So that started kind of really driving people to the website as people were talking about the impact of falls on public safety. On the 19th, we continued our media tour, and we were in Stevens Point, Wisconsin, and were interviewed by a news station there. On the 28th, we were in La Crosse and interviewed by a news station in La Crosse. And then on the 2nd of October, we were interviewed by Wisconsin Public Radio. So it was really interesting to see that the media tour that we did and all of our outreach efforts really did drive traffic to the website. So this data is for September 7th to November 28th, so just this week. People that come directly to the website, we are seeing spend the most time on the website. So that's by following a link from another website. You can see here the average engagement time, depending on where they're coming from, varies quite a bit. We have also learned that 67% of people are coming to the website from a mobile device, and only 19% from a tablet and 14% from a desktop. So we've changed a number of things since we found out that data. Originally, our home safety challenge wasn't configured for mobile phones, so we worked with our vendor to be able to change that, and then we added instructional videos and other instructions for using it on a mobile phone. So we're hoping that more people will be able to find that more user-friendly for mobile phones. And we are seeing that most of our users are coming from Facebook. So I'll talk about some of our Facebook ads, but our ads that we have been running on Facebook are performing pretty well. So this shows what the users are looking at on the website. And again, this is from September 7th to November 28th. We're seeing really good traffic to the home safety landing page, which is where the ads that we've been putting out are driving people to. So this number 1 here is the landing page for the home safety challenge, and number 3 is people actually going through the home safety challenge itself. We have made some changes to the landing page and to the challenge itself to make it a little bit more user-friendly and to drive more traffic to that. We have seen this, so you can see here, most users are spending a little under 5 minutes on the home safety challenge, which is down a little bit. People were spending a little bit more time on the home safety challenge in September when it was launched. So we're kind of going to continually monitor that and gather feedback on it and make it more user-friendly as we can. We did a number of paid media advertisements. So we did Facebook and Instagram ads, Hulu ads, Pinterest ads, Spotify, and YouTube. So like I said, overall, our Facebook ads are performing pretty well. Our Hulu ads are reaching into expensive TV markets like Milwaukee and Waukesha and Dane counties. And we added in YouTube, which is also generating pretty significant traffic. We've also been hearing that people on Spotify are hearing the ads quite frequently as well. We did end up eliminating Pinterest from our ad mix because that wasn't performing very well. So we've just kind of been looking at it and adapting as we can. So we did 2 ads. Our first flight was, which we're calling Sweetheart. It's our Sweetheart ad. That's flight 1. And then our flight 2 is our joke ad. And I'll show what I mean by that in a second. So we did that first ad with our launch in September. And then the second ad just recently. We wanted to avoid the holidays and all of the Black Friday ads. So that was just a little bit of a shorter ad run then. But lots of impressions, as you can see, lots of clicks. And we're really driving people to the website by doing those ads. This is just a screenshot of one of our Facebook ads. This is the Sweetheart ad carousel. And this is the video screenshot. So our hook was fall first, cart, not over your rug. And then this was our second ad flight, fall for a joke, not over your dog. I've kind of been playing with that a little bit to drive people to the website. We do have a Facebook page as well, facebook.com/fallsthroughwisconsin. We've reached over 237,000 people on that by running those ads that you just saw. We did start our Facebook posts at the end of August, and they were scheduled daily throughout September, and now just here and there as we have information to share. We have 47 likes, 78 followers, so still kind of increasing audience on that page. But we're receiving a lot of shares and tags from our partner organizations. And I just have a couple of screenshots from some of the ads that we've done on Facebook. Sponsors and the boosts that we did as well. But in addition to the Facebook ads and the ads on Hulu and Spotify and those different things, we also did an earned media tour campaign. So we were pretty busy in September with the launch. We're kind of going with our partner organizations at different falls prevention events and different things that were going on locally. So this snippet is just a screenshot from the DHS press release that I mentioned with the EMS and falls report. This is from the Wisconsin State Journal that we were mentioned in. This is from Wisconsin Public Radio. We were over in La Crosse and did an interview. We were up in Wausau and at a falls prevention event up in Wausau, and they showed this screenshot on this TV. And then we visited a couple of our LEAF grantees in De Pere, and then in La Crosse that we're doing some size classes too. So just to keep sharing the word about the resource and the website and the launch of the website. So for next steps, we are going to do our third ad flight in 2024. So we wanted to spread it out a little bit, not just inundate people with the ads all in September through December. And again, just avoid the holidays a little bit. We did want to do some of our ads near the holidays because we know that's when people are gathering. And that's when people may be with their older adult relatives and they could start some of those conversations. But we're planning to do the third ad probably in the first half of 2024. And again, we'll kind of play off of the fall for a joke or fall for your sweetheart, that kind of language to drive people to the website. And then we continue to present to our partners about the initiative as well. So we really just want to spread the word that this resource is available not only for consumers, but also for professionals to be able to use, for pharmacists to provide to their consumers, for healthcare providers, for physical therapists, aging and disability resource centers, you name it. We really want them to be able to use the resource and have it available for their consumers. And then we also plan for a larger reach out. So we know that we're not just gonna get everyone to the website by doing social media ads and things like that, but where do older adults congregate? Where do they access services? So we're thinking AARP, maybe they can put information in their newsletters, or pharmacies, maybe they can do big stuffers potentially, or healthcare providers, maybe they can put something about the resource on MyChart or electronic health records, whatever it might be. So we do plan to do a larger reach out for that. And then we also plan to do some earned media, since we did really see those drives in the website traffic with our earned media campaigns when we were out in local communities being interviewed by local news stations. So we plan to do probably hopefully at least quarterly, go somewhere throughout Wisconsin and then talk about maybe winter safety in falls or alcohol in falls or gardening, just so we're not just kind of talking just about falls, but kind of making it more relatable for people and more tangible. So we have those kind of topics picked out. So pretty excited to keep moving forwards with the media stuff in 2024. I'm just going to share a couple of different additional promotional resources that we've developed in the last couple of months. So just a couple of social media posts. So we did an article with natural resources about hunting safety in falls, as there's a lot of hunters in Wisconsin going out to their deer stands. So kind of, again, just making it more relatable and starting to drive those conversations. And again, just a couple of other social media posts. We do have an article coming about Older Adult Driver Safety Week, because there has been research about drivers and crashes and falls. And we have an article coming that's out now actually about winter safety, and then just some of these holiday posts that are on social media and our partners are sharing on their pages. If there's any questions, I'd be happy to take those questions. There's a couple of QR codes and links on the screen. So you can see on the left, there's a link to join the Falls Free Wisconsin Coalition if you're interested in staying up to date on what we have going on. And then if you haven't already, visiting that fallsfreewisconsin.org website so you can see all the great resources that are on there.
All right. Well, thank you for that presentation. There is one question in the chat. It says, do you have program services that provide individual home safety assessment prior to injury?
Yeah, that's a great question. We don't have that. That's not something that we had, the organization I worked for, does specifically. That might be something that some of our partner organizations do at healthcare organizations or occupational therapists or things like that, but that's not something that the organization I work for does.
All right, thank you. The next question, what do local health departments do for fall prevention?
Yeah, that's a great question, and it varies quite a bit, you know. I shared with Al before the session started, I used to work for a local health department and falls prevention wasn't even on our radar, which is interesting because I see the data now and I see that it is so important, but there are a number of health departments in Wisconsin that we do work with that are doing things for falls prevention. Some of our LEAF grantees were health departments, and what they did was work on collecting falls data. They worked with their fire departments. They implemented evidence-based programs, so like bingo size. We have a number of health departments that are facilitators for our Stepping On program. There's that section on the website specifically for community-based organizations, and they can host falls prevention events. They can develop a local falls prevention coalition. Seeing data is something that's super important that health departments typically do anyways for their community health improvement plans. There's a number of different resources on here specific to health departments. And again, just doing presentations on falls prevention is something that health departments can do, or hosting or being a part of falls prevention awareness events. Yeah, a number of different things health departments can do.
Yeah, thank you. A follow-up to the question regarding the home safety, the person indicated, the reason I ask is that we do this for expecting parents. This model can be used for fall prevention. So that comment.
Yeah, that's a great point.
And again, for those that are here, if you have questions, feel free to put those into the chat. We have a couple of more minutes left. Can you talk a little bit more? So what's the advantage of joining the Falls Free Wisconsin Coalition? What do you get for joining that?
Yeah, that's a great question. So we do a number of webinars throughout the year. So you'd be invited to all of the webinars that we host. We also share resources as they come. So if we ever update things on the fallsfreewisconsin.org website, we would send out information to our coalition partners on that. A lot of the work that the coalition is going to be doing in 2024 is to share best practices. So once we kind of develop some of that information and gather some of what the best practices are, we'll be sharing that out to the coalition. The coalition is engaged in some of the advocacy and policy work as well with the statewide budget legislation, networking with different organizations that are doing falls prevention work as well as another benefit.
All right, thank you. Ashley put into the comment, as a member of the coalition, it's great to share best practices statewide as well. I've learned a lot from partners in other counties and access to many great resources through the organization.
Yeah, thanks, Ashley. It's really interesting and just great to see the networking that's done throughout the coalition. Learning from other organizations that are doing something that you may have been thinking about doing. So you can talk to them about how it's worked, how it hasn't worked in their community. It has been really helpful, I think, for some of our coalition members.
That's good. A couple of minutes left here. Any additional questions or comments? Well, I want to thank you for a wonderful presentation. And as you see from the chat, a lot of resources. I think that website, you're going to see that number skyrocket after this, as folks will visit and share that. We have one last session. So as you finish this session, there'll be a break, a 15-minute break, and then we ask you to join us for the closing remarks and closing keynote that starts at 2:15. So again, thank you for the presentation, and thanks everyone for joining us today. Take care of yourselves.
Thank you.